Here, I'll let him introduce himself. Thank you, Viktor.
It's called Rikshospitalet. It's the biggest hospital in Norway, but thank you. Hello, everyone. I'm here from Chemfriendly to talk to you a little bit about slumming today, which is a very niche phenomenon, really. First, I just want to introduce a little bit our organization. We're a member organization. We work with queers and sex workers who are affected by illegal substance use. We are comprised of users, queers, peers, and allies. Our work is peer-based, which means that we meet all the members and all the users on an equal level where we give advice, support, and information about illegal drug use. We do a lot of harm reduction work where we give information about safer drug use, how to prevent overdoses, how to prevent adverse events, accidents when you're high, and we offer user equipment, which you've probably seen. We have a little stand over here. We also specialize in sexual health in relation to drugs, so drugs and sex combined. I just want to give some quick definitions before I start talking about the project, just to make it a little bit relatable to everyone who's here. Usually in the literature, when we talk about drug-related sex, we kind of include any kind of situation where you are high on some kind of substance that includes even alcohol, and having sex. And it doesn't necessarily have to be an intention behind the combination of the two, but it's when the two are happening simultaneously. The most common ones for the majority of people is alcohol, cannabis, and MDMA. So I'm sure that everyone here has some relation to that, and maybe someone has tried to use some of these drugs to enhance their sexual experience. So when we talk about chemsex, it's a very specific type of terminology that is very specific to the queer community. Typically, originally, we're talking about men who have sex with men. It specifically describes the act of enhancing your sexual experience with drugs. Originally, the definition, there was an original definition of what kind of drugs counts as chemsex drugs, which were GHB, methadone, and methamphetamine. This definition is kind of expanding a little bit in different types of literature in different countries. It's becoming quite broad, actually. And I think it's also fair to kind of start to expand what kind of people you can include in there as well, not just necessarily men who have sex with men. As an organization, Chemfriendly takes no stance on this, on a specific definition. There are so many parallels to drug-related sex that we think it's unnecessary to say that only if you did these types of drugs, it counts as chemsex. Right. So slumming is a subcategory of chemsex, which is when you inject drugs intravenously in a chemsex setting to amplify your sexual experience. The word slamming arises from the feeling when you take the drug. It feels like a door is slamming shut. And it has kind of originated to separate this subgroup from other type of drug users who inject, like, for example, people who do heroin. So it's a little bit special terminology that is used in the queer community to describe a very specific kind of setting within the chemsex. Typically, with the slumming, you're going to use stimulants. I just want to mention a little bit about chemsex as well in general, and also with the slumming, that you usually use stimulants to be able to last longer. And this can last for hours, it can last for days, it can last for an entire week. Typically, there will be gatherings, there will be parties, there will be orgies where people are coming together and they do these drugs together. Within these sexual gatherings, there's usually a lot of kinky sex happening. I also like to use the word more advanced sexual practice. Some might understand that as more extreme sex, but we don't really like to use that word. Right. So, a little bit of background about why I'm standing here talking about slamming of all things. About 10, 15 years ago, the literature started to report that there was an increase of methamphetamine all over Western Europe. This is also backed by feedback that we get as an organization in Chemfriendly from our users who are saying that slamming is now increasing and methamphetamine is very associated with slamming. So, we did a collaboration with a Dutch harm reduction organization that is called Mainline. They sent us a huge report that they published in 2015, where they also mentioned the increase of methamphetamine and the increase of the phenomenon slamming in the chemsex communities all across Europe. We traveled to Amsterdam to do a little field trip in 2023. So that was 8 years after they published that report, where they highlighted a lot of challenges, especially for the users, how they face challenges in their own life, you know, doing drugs that are very risky, in their addiction, and also in how they seek out help and resources. And 8 years later, we could see the change that happened after that report was published, all the work that was done to kind of change the systems to help support these type of users. We created our own report, heavily based on that one, to have a local Norwegian resource. Yeah. So I just want to try to highlight a little bit of the most central challenges that these people, these users face, people who do slamming. The most obvious one is addiction. It's a very strong drug, very easy to get addicted. People tend to lose control of aspects in their life, like work, their social life, their health. They experience physical health challenges, obviously from bad injection techniques. This is very common. Cardiovascular health challenges. Based on how long these sessions typically last, you see a lot of sleep deprivation problems as well, which eventually can lead to psychosis. In addition to that, you see a lot of mental health challenges, depression, anxiety, and challenges related to your identity. And this is where it gets a little bit complicated, because in the gay community, in the queer community, you will often see that especially gay men are very overrepresented in statistics regarding depression, anxiety, and loneliness. So a lot of these things become something that they need to cope with somehow, and they are kind of driven into chemsex communities. And although it doesn't necessarily have to be a bad thing, the more they need to cope with a challenge, the more they risk to start developing a problematic relation to the drug and to the use. In addition, it's also used, chemsex is also used to increase sexual confidence. And a lot of people in the gay community struggle with having the sex that they want, feeling the confidence that they want to feel. A lot of people, a lot of queers can experience the queer community as a very hard community, a very superficial community, and that leads to a lot of internalized self-image problems. There are also sexual challenges, of course, because there's a lot of sex happening. Uh, Historically, there was some risk of HIV transmission. This is a little bit less today because we have the PrEP that effectively protects you from getting HIV. And also hepatitis C. Hepatitis C is a little bit more of a challenge today. You can also develop sexual dysfunction where they find it hard to have sober sex again. Uh, the, the sex also triggers the need to do the drugs. Yeah. When they are searching for treatment, they find challenges because the treatment is only focused on the addiction, not the sexual part. They also have a really hard time to talk about their sexual life when they come to treatment, even though it's such an integral part of their challenge. As if it's not hard enough to talk about sex when you go to drug therapy treatment, you also have to talk about kinky sex. So a lot of people feel ostracized from their treatment, and I know that some people talk about it today. The challenges of the fragmentation of a treatment when you, for example, go to a psychologist, and who's going to treat what. There are so many aspects of this challenge that you need to kind of take into consideration. So you maybe you need addiction rehabilitation, you need sexual addiction rehabilitation, you need therapy, maybe you need some trauma therapy, and you probably need some STI treatments. So a lot of users, they experience when they come to seek treatment that there is no knowledge about what is chemsex and what is slamming especially, and why do people do it. So we created a report in Norwegian. We felt like it was important to have a local knowledge resource. It's based heavily on the report from the Dutch main line. I wanted to include an understanding of how the local situation looks like. So I did interviews with Norwegian ex-slammers, and I also talked with local institutions like sexual health clinics and rehabilitation units to try to understand if the challenges here in Oslo, in Norway, are the same as in the literature. Which it pretty much was. So I created this report. You can get a copy here if you are curious about what I wrote about. It's in Norwegian. It lifts the awareness of risks and harm reduction that we found important in this topic in a local language. This was described as important for people searching for information because they needed something that was easy to read. Yes, I also collected some limited Norwegian data and literature. There isn't very much. And I also point out that we need more of that. So, in the end, I wrote some recommendations. I wrote here requirements. It's a very hard word. I think that we need to increase the gathering of data. We need monitoring on this situation. It is spreading all over Europe, and multiple places in the Scandinavian countries are also reporting on an increased slamming and use of methamphetamine. We need prevention and harm reduction. We need to reach this group. They are notoriously hard to reach because they are prevented by so many layers of that stigma. The stigma around their sexuality, the stigma around their sexual practices, the stigma around doing the drugs that they're doing, all of these things. So we need to reach out to this group. We need to present them with good harm-reducing information on how they can stay more safe. We need to increase professional expertise in the institutions that treat them. In the institutions, they also need to develop a cultural understanding of the queer community. Because if you don't understand queer culture, it will be very easy for you as a treatment personnel to ostracize your patient from the treatment. Yes, we need to tie together the treatment options. And in this, in relation to that, Mainline wrote something about something called co-located care, where you collect all of the instances that you need to treat the whole person, the holistic treatment that you were talking about before, that you have a sexual health clinic together with rehabilitation, with trauma therapy, for example. Yes, I would just like to end on that note and say that most important for anyone who will meet someone who has experience with chemsex or with slumming, especially if you work in the healthcare units, is just to meet people with an open mind and curiosity. That will take you a very long way. Thank you.
Question here.